These sections are all created by the need that Volt has expressed or the veteran navigation team has expressed for being able to track not only housing placement, but the kind of veteran experience to being connected to housing. So the first thing we want to talk about is the Volt review date. This would be the first date that the veteran was spoken about or discussed in case conferencing. So if that would be the usually our veteran case conferencing meetings, which are our veteran navigation meetings, Thursdays at 9 a.m., hosted at the YWCA currently. So whatever that date is that the individual was first reviewed by case conferencing is the date we want to keep. Once that's in there, there's no reason to change this date. It's just fine to keep it because that would tell us that was the first date that the individual was reviewed. There may be subsequent times that they are reviewed, but this is the first time and we want to capture that. Then below that, we have eligibility, and this is eligibility for VA healthcare. So you'll see that there is a drop-down option. The first two options, VHA registered and eligible is saying that the person is eligible for VA healthcare. Not registered for VHA is that the VA has no record of that individual or household being registered or eligible for veteran healthcare at the VA Puget Sound. And then we have the two other options, not eligible for the VHA, which is our veteran healthcare, or not eligible for any VA funded programs. And there's a difference between these two. If these are clicked, there will be smart logic built in that asks the reason the individual or household is not eligible. It's important for us to be able to know that difference, and we're working with the VA to try and ensure that, in particular, when eligibility is being checked, that we have the reason why someone is not eligible. If not eligible is clicked for VHA, not eligible, there will be four options that drop down under the reason not eligible. One could be that they served active duty, but they were verified other than honorable as their discharge status. They served active duty less than the 2 years post 1980, which is a requirement for VA healthcare eligibility. They had no active duty. They may have been National Guard and never called up to service, or they were dishonorably discharged. The reason that we have the not eligible for VA funded programs at all is that someone may not be eligible for VHA due to one of the reasons that's a drop down here, but that may mean that they are still eligible for SSVF resources or grant and per diem resources. It's a little wonky, so that's why we feel that we need this additional reason for not being eligible, because just knowing someone's not eligible for VHA does not actually tell us if they're eligible for other services through the homeless service continuum of care that the VA funds. One example, VA not eligible for VA funded programs, that would be clicked if the reason someone's not eligible is due to a dishonorable discharge, or if they have not had any active days of any active duty. So people are not going to be eligible, households or individuals are not going to be eligible to get the housing assistance if they did National Guard without being called up or were dishonorably discharged. A housing plan is what is determined as the most successful housing intervention that may work for a veteran household. There may be multiple attempted during someone's experience of homelessness, but this is the first one that we want to be able to work with to ensure that a veteran can be progressively engaged should those not be successful housing interventions. So this list was created by the veteran organizational leadership team based on the housing interventions within the homeless homeless service system for veterans. As you can see, we do know that there are gaps within the available housing resources, so being able to identify when that is occurring. With higher level of need, if there is not the type of intervention that would be most successful for a household because they would need something more like a skilled nursing facility or assisted living opportunities. You also can choose other. So let's say, for example, somebody is going to only need diversion and they are going to be able to self-resolve with that diversion intervention. You may be able to just put in here other and list that diversion is being connected with, and then that would be saved for that housing plan for that household. The goal of this other is to ensure that if anything is missing from this list, we can capture it. And we want to be able to see trends that if there is something missing, that we can create another drop down to have it included in the list chosen. So please use other in those cases. The big thing we want to also stress is we know there are gaps within the homeless service system, and we know there are gaps within what availability there is for housing interventions. So please do record which type of housing intervention is going to be most successful for someone. It doesn't mean that that's going to be available right away, but it does help the homeless service system for veterans then speak with funders about exactly how much of a resource we may need when funding decisions are becoming available. And our veteran organizational leadership team or our veteran navigation case conferencing team is able to help our funders understand the need within our community. So please do highlight that. For example, if we don't have a rapid rehousing intervention available that isn't SSVF, we could even add in the notes that that is something that we know is not available right now, but we do need to connect on it. Just because a housing plan is selected for a veteran, it does not mean that that is a referral. This is to ensure that we know which type of housing plan is going to be most successful for a household when resources become available. Again, this does not create a referral. It's allowing for the veteran homeless service providers to know which type of intervention a household needs when it becomes available. For example, if we select HUD-VASH, that may not mean that somebody is going to be referred to HUD-VASH that day. We just know that's the type of intervention that that household needs. So for example, we could put in the notes that we know that that is the type of intervention someone needs and put no referral made for household. Another example may be that there are HUD-VASH vouchers available during a case conferencing meeting. In that case, we would want to see that someone is registered and eligible for the VA and they do need HUD-VASH. Then in the note, we could put that that household has been referred to HUD-VASH from the case conferencing meeting. Referred means that they are going to receive a referral to HUD-VASH. Not that they're enrolled, not that they are being given a voucher right away, but that there is a referral that is going to come because there is available resources. In that case, you would want to say that the veteran was referred during that case conferencing. If we just know that they need a housing placement type of HUD-VASH, because that's their housing plan, but the resources are not available, in this section, we may not need to put anything, just additional notes that you think may be necessary for the housing providers to consider and the homeless service providers when we are making determinations of which households are being referred to which housing interventions. A good rule of thumb is that if you don't see the opportunity to have a drop down actually reflect what you need to communicate to the homeless service providers, then you can add that note in here. We do not want to make this case management notes for a household. Those can all be done by organizations. This is just relevant information that you think household for making the best determination of which housing interventions might be good for that household from the case conferencing space.
If someone is getting a referral from case conferencing to HUD-VASH, for example, it's going to be said in this note that that household did receive that referral. After this happens, the referral specialist still has to go through the process of making a referral, which does not automatically happen when these buttons are pushed or when these are selected.
Next, we talk about permanent placement. So there are some housing placements that occur outside of HMIS, and we want to make sure to be able to capture those reports inside our Volt form so that if we see someone has a permanent housing placement, we're able to move them off of our active list and move them to our inactive list. If you look at this, we may hear that the person has moved out of the area or something like that. That is an option that we can put in their housing plan, and we can say what housing type they moved into if we do know that that has occurred.